Well, thanks again for joining us for today's CareOptimize Insights webinar series. In this presentation, we're going to be reviewing the CareOptimize free template State of the Practice report. This report allows you to gain all types of insights as into how your practice is performing financially, through insurance payers, with production through providers' tasks, etc. Throughout the duration of the presentation, we're going to highlight some of the different areas in which the CareOptimize State of the Practice report is helping practices gain more insights and make data-driven decisions. And then we'll jump into a Q&A at the end. My name is Kegan Williams. I'm the Chief Commercial Officer here at CareOptimize, where we are helping practices transform and optimize their EHRs to perform well in either value-based care or whichever programs or initiatives the organization is going through for this year. Kicking things off, our State of the Practice report is revolutionary, in our opinion. It's super simple. We can plug in. It will be complimentary for the first 30 days, runs in about 30 minutes, and it works with any electronic health record or practice management system. Starting off with some of the different options available and some of the insights we'll gain from the CareOptimize State of the Practice reports, we'll start with active contracts. This segment of the report is going to show practices all their active contracts with specific payers and pertinent details that pertain to these specific contracts, when they became effective and when they expire, and so on and so forth. A BBP job list. This is going to show all jobs in the BBP and also their last run and last time successful, allowing you to see the difference between when the jobs are being run, when they were successful, etc. Another item on the report is going to be a list of all the licensed providers. Sometimes practices have providers that were working with you at one point or not at another point. The licensed provider segment pulls a file from maintenance, and it lists all of the providers and their licensing types, allowing you to quickly and easily see each one of the different users in the system and how these providers are licensed and credentialed with you. AR aging. We all know that keeping track of accounts receivables is pertinent to succeeding in, financially within your business or your medical organization. Quickly referencing your outstanding accounts receivable by plan, and then divvying them up into 30, 60, 90 days plus. As you can see, we have the dashboard here, which allows you to see each one of the different buckets that your AR is performing within. And then that will enable you to drill down and decide where to focus your new efforts as far as collections go and the different items that pertain to your financial AR strategies. Hopping in, we have a bill lag time report. This is going to show you the average amount of time elapsed since the date of service and the first bill in the last 30 days. So really just simply looking at when the patient was seen or when the service was rendered, and then when that bill was submitted, will enable you to know the lag time between how you're actually performing from the provider to the claim process. We have a charge entry lag time, once again covering the average time by provider for charges to get in. So when an encounter is completed, and then when that charge makes it in, will help us indicate whether or not we need to be focusing some attention towards getting these charges in as they're completed, or we'll just be able to see that we're turning them around pretty quickly in the case you're performing strongly within this segment. Denial rates are always super important, right? When we submit claims, we don't want them to come back and be denied. And if they are denied, we want to know why and how to improve upon that process. The denial rate segment of the report is going to break down what caused each denial and allow you to make modifications within your system to prevent this from happening in the future. We also include in the State of the Practice report a top 20 payers segment, which shows you the total amounts of transactions from each payer. I find this interesting because sometimes when we sit down with practices, they have a focus on a specific handful of payers. When we're able to view these particular reports, it'll show you actually how much they're contributing to your overall finances. Unapplied credits, we do want to make sure we're keeping our books nice and neat. So maintaining the unapplied credits is going to be an important area for you to manage the encounter levels and account levels within the financial transactions happening in your business. Hopping in, another segment of the state of the practice report is going to be our average appointment per day by provider. This will show you how many appointments each provider is seeing or each provider has booked, and then also no-shows, and then the average of all these together, allowing you to determine, which patients might be having more particular no-shows, which providers might contribute to those no-shows, and then also showing you an average of how the practice is performing with appointments versus no-shows. First, third appointment. This particular segment of the state of the practice report is really neat. It monitors the provider load by accessing appointment books and then finding the third open time slot. This also allows you to assess the lag time between that and the current date. So just determining when in the future your providers are going to have their third open time slot available will indicate how busy they are and which ones we want to drive traffic towards and book up on the appointment book. Practice management tasks not completed. For organizations that utilize the task management system within the practice management component of their electronic health records, we want to make sure that we're actually breaking down which resource and which events have not been closed and which tasks have not been addressed. I know it seemed to me kind of like an inbox, right? But I want to make sure that every task that I have on my plate is being addressed and being taken care of. So making sure we're monitoring the resources and the events that are still open is going to be important to closing and catching up on some of the maybe busy work or items that are outstanding within the practice. Key appointments with no charges. It's always important to make sure that if an appointment happens, there's an action that's indicated afterwards or a charge that's associated with this. The CareOptimize State of the Practice report includes a segment that will incorporate the total transactions and amounts from each payer, and then the key appointments or kept appointments with no charges. For those of you that are participating in the MIPS Quality program or for practices that see Medicare Part B patients at all, knowing which MIPS quality measures your practice has that are applicable to the workflows that are in place is really important for making sure that we're keeping up with our quality scores. So a segment of the State of the Practice report actually includes which CQMs your practice should be tracking on and which ones apply to your particular providers and your organization. Moving into the MIPS risk assessment, again, for practices that have Medicare Part B patients or are participating in MIPS at all, it's important to know how much of a surplus you stand to gain from your participation, right? So MIPS is a value-based payment adjustment for Medicare Part B claims. It does open up opportunities for providers to make additional income or additional revenue off of each encounter that's billed, keeping in mind that there is a surplus that can be generated from top performance and taking into consideration when you're seeing patients and when you're organizing your workflows, how much this could stand to add to the practice's revenue is significant with respect to how you're going to chart, how you're going to document, etc. EHR tasks over 7 days old, similar to the practice management tasks. If we are utilizing a task management component of our electronic health record, we want to make sure we're actually closing those tasks. So taking into consideration anything that's over 7 days old, we might want to focus down on that report or that segment of the report, and then have a meeting or two with certain stakeholders within the organization that will help us get these tasks closed. Maybe it's a provider that needs to approve something, or maybe it's a nurse that hasn't finished a document. We just want to make sure users with more than 20 outstanding tasks are actually taken into consideration, and these tasks are being addressed, closed, or some sort of actions being taken on them. Once again, hopping into the EHR tasks as well, an average amount of time elapsed since the date of service and the first bill in the last 30 days is going to be important for your workflow and your submission of bills. In the state of the practice report from CareOptimize, we'll include this particular segment for practices to drill down into when dates of services were happening and when bills have been submitting, allowing you to determine the time in between. Provider approval queue. Many practices are busy if you bill incident 2, or if you have additional provider staffs or mid-levels performing procedures. We want to make sure that these procedures are being approved by providers within the practice. So the provider approval queue segment of the report will show us all the open EHR tasks assigned by users that are waiting for providers approval. Open referrals. When a referral is made, we've made that referral for a reason, right? We want the patient to go see a specialist, or they need to go to the lab, etc. It's important to make sure that these referrals are actually closed and that action has been taken, and we have an updated medical record that includes, the outcome of the referral, right? Whether the patient made it, whether they rescheduled, whether they didn't make it, etc. So in the state of the practice report provided by CareOptimize, we include a list of all the referrals that are still open and have not been marked as a status of completion yet, making sure that you have a quick, easy, referenceable call list to follow up on and help execute these referrals. Rosetta Status. This shows anything stuck in Rosetta for more than 24 hours. We don't want to have anything building up in that bucket. So taking into consideration everything that's been sitting in there for more than 24 hours, we can then use these insights to take action and get them out of the bucket, essentially. Unmatched refills. This will be a list within the state of the practice report or segment that includes all the unmatched refills by providers. It's going to list out each one of them, the amount of refills that are unmatched, and then the earliest one that was written. We also have different versions within our report. This is useful for system administrators. It helps identify different template versions being used. As electronic health records evolve and upgrades are made, there are different versions of different templates being used sometimes, and we want to make sure we keep track of that, because as we do certain upgrades, this might impact the usability or workflow of your electronic health record system throughout the amount of time that you've had it for. Template usage. Segment of the state of the practice report is going to show us each one of the templates that have been used in the last 2 months, and it helps us discover the focus areas, right? We have a lot of templates oftentimes within the EHR. Some of them are obviously being used more than others, and some of them should be used more frequently than they are. So our template usage segment is going to enable practices to drill down and focus on which templates are being used frequently, therefore maybe making enhancements, or which templates should be used and are not being used, enabling you to maybe offer more training or support for your provider staff or your clinical staff to begin using these templates. Sometimes they just might not understand how to use them, and that could be the reason for which the template's not being used. Average days to complete documentation. We know documenting within an electronic health record is sometimes viewed as busy work, or a task that needs to be wrapped up. A lot of stuff is going on. You're seeing a lot of patients. We want to make sure that documentation is being complete, because there are oftentimes correlating claims that are going out, which the documentation is intended to support. So the documentation average days to complete segment of the report is going to show you the previous month, the difference between encounter date and the last generated note, and then it can prevent any legal liability, right? We don't want to have these encounters open for too long. We want to make sure that as the patient leaves the office, at that moment or shortly after, these encounter notes are being completed and flowing regularly within the billing process. We do also include a CCM report. This shows if the correct CCM codes are being billed and the associated diagnosis codes. For those of you who are performing CCM or participating in a CCM program, patients must have 2 chronic conditions in order to enroll in the program. And there's an array of different codes that might be able to be used. So the chronic care management report is simply showing you which CCM codes are being billed, making sure they're correct, and they have associated diagnoses that support the patient's enrollment in the CCM program. Last but not least, that we will be covering on the State of the Practice Insights is our unspecified and new codes. This is going to show every code used by providers in the last 60 days. So it's essentially breaking down what would normally be in your super bill or your routing slip and showing you the frequency in which they've been used with a window of the last 60 days. All of these different segments are included in the free State of the Practice report for partners of ours. If you'd like to get more information on it, or if you would like to set up an appointment where we can review potentially installing and making this report available for your practice, it will be open for 30 days after the installation. CareOptimize consultant would be happy to hop on with you and review the details and describe or answer any questions you might have as to how they pertain to your practice and how we might be able to support improving these workflows, right? The idea is to gain a massive report with different segments that provide insights. Oftentimes we see practices are performing very well on each one of these different reports that are included. And sometimes there's a couple little spots where we might want to focus our attentions and improve quality, etc. So please feel free to reach out to either via our website or to myself directly. Once again, my name is Kegan Williams. I am the Chief Commercial Officer here at CareOptimize,